right on to Broken Series, and Dr. Burgett is on the line. Doctor, morning.
Morning, and welcome back after our break. It feels like a long time, and a lot of our listeners have sent in hundreds of queries, which I'm not going to get through because they were anticipating our show last week, but we had technical glitches. But let's just go back a week and briefly summarize what we're going to talk about. We're going to be talking about really important health tool advances in 2023 and the up-and-coming 2024, which really are shaping up to be very exciting for, I guess, healthcare innovation. And I wanted to talk about a number of new tools and technologies that are in development, and many of which will have the potential to revolutionize the way we manage and treat and even pick up diseases in Botswana. So let me start by first asking, do you track how much you've walked a day on your phone?
I don't. I used to, but nowadays I really don't.
Well, lots of people do. And, it's so easy these days that, as everybody says, your phone is actually one of the most powerful learning tools that we have. 30, 40 years ago, huge computers couldn't do what our simple cell phones can do today. And part of what they can do today is actually revolutionize the way we manage healthcare. I mean, I have been doing clinics out in some of the small villages for 15, 16 years, and then the way we communicate with our patients out in Etsa and Chakawe and Kumare is through, technology like WhatsApp and like, email if they have it, and even, them reading our Facebook sites, which was not possible. And this has actually enabled, engaged and empowered some of our community out there in terms of how they manage things, which we never did before. So that's really important information. And increasingly there are people wearing these smart watches and wearing these Fitbit things that wearable devices, what I call them, that fitness trackers, these smart watches. They're becoming increasingly popular, and these devices can collect a huge range of data, which us as doctors can use to track, your heart rate and your sleep patterns and your activity levels, and actually look at it to identify problems with you and actually manage chronic conditions. So this is really important. I'm going to launch into that one first because there are lots of these wearables on the market. I'm sure you've seen friends who've got these fancy watches, right?
Yes, Doc. People are always wearing those French. At first I thought they're expensive, and then I realized.
Yeah, well, at the moment they're quite costly, but I can tell you the price is going to come down dramatically. And a lot of these watches, and there are even rings that people can wear, which, packed with lots of technology that can actually pick up your distance of walking, how much you walk, how speed you walk, when you sleep, how much were you than actually lying on sleep, how much were you turning, and how much effect did you get. Now, particularly in my of cardiac or heart medicine, some of these watches can actually pick up the rhythm of your heart and do a very basic ECG or electrocardiogram, looking at the electrical activity of your heart, help you having, an issue. That's really important in terms of how we can track progress of blood pressure, etc. There are new devices on the market in the form of a watch that actually measures your sugar continuously from the sweat that you produce on the back of the wrist. So these are really, really important advances that are going to bring healthcare to people in terms of technology. And then, if you want a Christmas present and you have somebody who really fancies you or is your partner, just say you want a wearable device. It actually will be far more useful than anything that is jewelry related. So that's really important in terms of wearable devices. So it's really important. They're all available in Botswana. They are a little bit pricey, but I can tell you it is worth an investment if you can afford it, because it will actually manage you at home as well. So that's really important. The second one that actually has taken a big way is telehealth, which basically means telecommunication technology to provide health services.
Doug, I'm having difficulties trying to get you properly. You're not as clear as you usually are. I don't know if it's me this side or you. I'm not sure.
Okay.
Because you keep cutting.
It keeps cutting. Well, I'm in the same place. Is it still cutting?
Yes. Let me do this. Let me call you with another line.
Okay. I'm waiting.
Like it's solo vibes. Every day 4th of July. Shaku shaku all night. Every day 4th of July. Don't try to diss on me, girl. Nah, don't try to jealous me, girl. Yes, better things, yeah, I'm on, girl. Every day 4th of July. Shaku shaku all night. Don't you try this on me, girl. Nah, don't you try jealous me, girl. That's right, better things, yeah, I'm on, girl. Every day 4th of July. Shaku shaku all night. That's right, I'm out of the GOA. I ain't got time for games, so no. That's right, I'm begging you to stay. I'm done playing all the
I hope I have managed to solve the situation, Doc.
I hope so too. Is this clearer?
This is clear.
Wonderful. Well, we were talking about health tool advances for the public in 2023-2024. We talked about wearable devices that people are buying, smartwatches, fitness trackers, increasingly popular, can collect a wide range of data in terms of sleep and physical activity and irregular rhythms. That devices are coming on the market in 2024, which can actually measure blood pressure and sugar just from the back of your watch. So these are really exciting pieces of data which, prevents you from the need of going to a hospital to check your blood pressure or check your sugar. Really important things for cardiac patients and diabetic patients. So that's important. So get that gift if somebody can afford it for you. They are costly, but I can promise you within the next 2 or 3 years, you watch those prices really plummet down because everybody's doing them, and a lot of these companies, Apple and Samsung and then some of the other ones, Huawei, are trying to make it cheaper. So that's really important. We were talking about telehealth. During COVID lockdown, when people couldn't get to the hospital or clinic or wherever their doctor was, the medical community then launched into telehealth, which is use of telecommunication to provide healthcare services. And this has really gone on after the lockdown was lifted. And these include things that everybody knows about: Zooming and video conferencing and phone consultations and, remote monitoring of health. And this has made healthcare far more accessible for people. We have a huge country and people are spread all over Botswana. So it has been especially useful for those who live in rural areas who have difficulty traveling to see us, in bigger towns, to send their information via WhatsApp or even to do a teleconference, a video conference on WhatsApp. And that really has revolutionized health. Do you have some of your members living in remote villages?
Of course, Doc, of course.
And how far out?
Seroe?
Yeah, so at Takoma, where we used to run a clinic, we used to deal with people, from Letlhakane, from Paje, from Orapa, and Radisele, all by communication through telehealth, which spans all this sort of stuff. And it really saves a lot of people's lives, especially during lockdown when they were diabetic and they went into a coma, or the sugar was high, or the BP was uncontrolled. We'll be able to manage it through this telehealth. So this is really, really revolutionizing us, and our government is on a mission to digitize our space. I can hear some background.
I can also hear it.
Okay, are we still clear?
Yes.
Okay. We're breaking up this conversation, but anyway, I want to talk about two more before I pause for any questions, because they're questions actually from last week. One is the other one that's revolutionizing doctors' way forward in terms of health is precision medicine, which is basically an approach to healthcare that takes the individual into account. So if you look at a patient in front of you, they are 26 years old, they are ethnic extraction, they are this height and this weight, they live in Seroe, they live in a hot climate, they're out in Shakawe, so lifestyle factors. We're able to develop personalized treatment plans and pick up early stages of disease. So these are really, really, really important aspects of health. And last but not least, before I pause for thought, is the field of diagnostics. We're now actually just with a small drop of blood able to pick up hundreds of different things, different cancers, diabetes, kidney disease, liver disease, cholesterol, just with a drop of blood. And this is called point of care treatment where there's tiny little cell phone devices which we put a little USB port on and actually can pick up all sorts of things. So this is really important in terms of technology. I'm going to pause there. Do you have any questions? Because we have lots of questions, but I wanted to ask if you have anything.
Let's go to the people, Doc. They missed us last week.
Yes, you're right. We've had lots of things here. We've had I'm just going to choose some interesting ones, and clearly there are some IT guys out there. Somebody talked about, asked a question, Doctor, can you talk about nanomedicine? And that must be coming from somebody who's an IT guy. Nanomedicine is basically the application of nanotechnology, which basically means really, 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 really tiny things which we can inject into your system, into your bloodstream, and actually it will track your blood as it goes through the body. It can actually track and pick up things, hunt for cancer cells, hunt for viruses, pick up circulating bits that shouldn't be in your system. They're called nanosensors. And it's a big part of medicine where, literally a tenth of the hair on your scalp is the size of this stuff. Nano means very, very small. And this is going to have a significant progress in advancing healthcare. So that's really important. Somebody's asked a really interesting question here. Doc, you talked about, and this has just come in now, you talked about telehealth. What about telepsychiatry for mental health services? That's a really interesting question. I never thought about that. But basically, I guess telepsychiatry is about delivering mental health through technology, such as communicating with video calls, people who are suicidal, people who are deeply depressed, people who don't want to go out of house because, they're afraid something might happen to them. It's estimated by WHO almost 1 billion people on the planet have mental disease. So this is really, in terms of telepsychiatry, a really important piece of information. Somebody's written in here just now saying, Doc, I'm in the field of data analytics, and how is that going to help healthcare? Well, it'll help. Data analytics basically means we have more and more information. And the more information we have, the more we can analyze and predict and make decisions in terms of how we track. So if we, for example, now in the public and the private sector, we're moving to what are called electronic health records, where everything is actually put on the computer, we can share that data so we know, what the prevalence of diabetes is in our country, what the incidence of obesity is in different age groups, how many people have high blood pressure, how many people have cancer. And this is going to be actually really important in terms of this machine learning that we're going to develop. That's really important. Somebody's asked, these are all technical questions, but somebody's asked about cybersecurity. Clearly these guys are all IT people. And they've asked about the safety of the data that we're talking about, that we're sharing this information. And this is really important. Healthcare organizations handle and store thousands of sensitive data. And of course, it's important in terms of comprehensive cybersecurity. And it's not my area, but that's really important. I'm going to answer one more question, and that's about implants. Doctor, my grandmother has a battery in her heart, and I wondered whether this technology has spread to other aspects of disease. Good question. A battery in the heart basically means a pacemaker, where the natural electrical power of the heart diminishes, and what we do is we put a little artificial battery about the size of a 5-puller coin just under the skin and feed it into the heart, and it actually powers the heart. This is a revolution in terms of electrical implantation for people who actually would otherwise have died. We're actually now putting brain implants into people who have a condition called Parkinson's disease. It's called deep brain stimulation, where we put little sensors in the brain that actually help people move. Parkinson's is a condition where people shake and they can't move properly. So this is really happening in a big way. One of the first in Botswana was what's called a cochlear implant. People who are deaf, particularly children who are not born with the right tools inside their ear, we can actually implant it. And one of our doctors, excuse me, in one of our private hospitals was the first to actually put in a cochlear implant to allow a deaf person to hear. So this is really massive revolution in terms of healthcare. So I think everybody there needs to watch that space in terms of healthcare and the unique way it's going to change and revolutionize the way doctors practice as well as the patients empowering themselves and managing their case at home. One more question here, which is I can't let it go, is one. I think it comes from one of our expatriates. Doctor, I'm originally from Japan, and we have all this technology that you're talking about on the radio this morning. Can you talk to us about other aspects of home-based care? In Japan, we use toilets as healthcare tools. He's right. I won't read the rest of the question. Basically, the Japanese are at the forefront of managing. For example, we've talked about this in our program before, where we know, depending on how you inspect your poo, if the color of your poo changes, if the consistency of your poo changes, the chemicals in your poo change, you can actually pick up blood in the poo, we can pick up changes in color. And the toilet is a smart toilet developed in Japan that actually can tell you and light up to say, you know what, this is not your normal poo. Go and see your doctor because we can detect blood in there. We can detect that there's something wrong with your liver. This is a major advance because everybody poos every day. So we can actually have a smart toilet that actually can pick up disease well in advance because a lot of things occur in the gut.
Doc?
I'm here.
Okay.
I was wondering whether you got cut off or... I know I had to talk really quickly because we were short of time, but was there anything you wanted to ask in terms of healthcare?
I think the only thing that I got was about the watches, you know.
Yeah.
Most of the time, like, I've just known that maybe they just count, you know, the steps that you have taken during the day, and you said there were other two things that you said, the blood pressure, the blood pressure, and I'm forgetting diabetic. I don't know. I'm forgetting the other one, but I was actually shocked that
there are so many. There's so many. I mean, these wearable devices are being developed to help people with diabetes manage their condition. Because, for example, a wearable device to continually measure blood sugar levels can actually even deliver insulin into your system if you're insulin-dependent diabetic. The new ones that are coming out within the next couple of months are little devices that you wear on the back of your wrist that actually can measure blood pressure continuously. And those who are on blood pressure pills can actually see whether the blood pressure is controlled. There are some that are actually going to pick up from your sweat the chemical imbalances, whether you're dehydrated, whether your mineral levels are low, whether you're low in magnesium or potassium. And this is really, honestly, it's a revolution in healthcare that basically means that the individual out there, the population at large, don't need to go into a hospital. They can pick up conditions early and then go to the hospital and say, look what my watch is showing me. Is this correct? Rather than waiting until they have a serious issue, whether it's cancer or diabetes or blood pressure or even a stroke, God forbid. So this is the wearable device that we're talking about, and it's going to change everything. There are also wearable clothes, by the way, clothes that actually have sensors that can pick up whether you're sweating correctly, whether you're overheating, whether the sweat that you're producing is actually a very concentrated sweat. So there are a lot of these wearable clothing items are going to change the way things pick up and continuously track on your phone. It'll communicate to your phone on a Bluetooth system. So this is going to be available in the next couple of months. So watch that space, even in our beautiful small country.
Doc, these things are about to take your jobs.
So that's really important, and I know there's lots and lots of things that are coming in now, questions, but that's, I think we run out of time, and we can't sort out everything on one program, but that's something that everybody needs to talk about.
All right. Otherwise, thank you so much, Doc. We'll meet again next week. Saturday. It's been a pleasure.
Cheers.
Right, it's 9:48 on up to your station of choice. Coming up next.